G'day, Theo here from the Muscle Mechanics. Quickly going to go through a warm up of the forearm. So I'm sure you've done this heaps before, but first of all get about half teaspoon of your oil, getting a good application all over both of your forearms. Main principles here is we're just trying to warm up all the tissues in the forearm and get rid of any sticky points. So starting off with the edge of your thumb on the top side of your forearm, and we're just going to get a little bit of friction and start assessing and treating your own forearm. Cool. Next, we're going to get a good grab around the wrist, restrict the superficial fascia of the wrist, and then stretch away from the point that you're grabbing. So you'll feel a little bit of pull up the back of the fingers and the thumb, which is fine. So it's really important to warm up your fingers and your thumb as well. So to do this, I just get my knuckles into the inside of the palm, and same thing, just trying to warm up the tissues and get rid of any little tight sticky corners. Down the fingers, same thing, treating the thumb a little bit, just checking through your own tissues. We'll move on to a quick postural adjustment to prepare us next. So we're on the subject of self-care as a massage therapist, and the postural adjustment that I use all the time with my clients is the Superman adjustment. So the easy version, we start with our feet about shoulder width distance apart. You can bring your heels about 15 centimeters away from the wall. And the reason we do that is so that it's easier for us to tuck our tail. So tucking the tail is the cue, which means engaging your abdominals a little bit to pull the front of your pelvis up at the same time as engaging your glutes. And the key here is to press your entire lower back straight flat into the wall. So once we've got that, you should feel your abs turned on a little bit, or maybe a lot, your glutes turned on a little bit, and then we're going to bring our elbows up to right angles. So here, depending on your mobility, maybe you're going to be all the way up here, which is not a problem, but the key with this adjustment is to try and press ourselves into the wall. So wherever you are, we're focusing on pressing the back of the wrists into the wall, the back of the fingers. You might have forgotten about your lower back, so we're keeping the tail tucked, lower back pressed into the wall, elbows pressed into the wall, back of the head pressed into the wall, maintaining a little bit of breathing, but the focus is really on the adjustment. So there's a lot of tissue stretching and a lot of tissues being activated to get into this posture. And then if we want to continue with this, like this is going to be easy for some people, really hard for others. If we want to make it a little harder, we can start walking our feet in towards the wall, but keep the tail tucks so the lower back's flat, keep the hands, the wrists, the back of the head, elbows all pressed into the wall. And then if they're all pressed into the wall, we feel like we're ready for some more, we can start to lift our hands higher. So it's going to require a ton of effort, but it's a really nice thing to work on. It gives us good shoulder positioning, good pelvis positioning, and teaches us how to tie in the shoulder positioning and the pelvis positioning with the abs at the same time, which cues us for working really well with our clients. It gives us the shoulder mobility to not be working in poor patterns of movement.